I went to visit a friend of mine on admission in Igbobi. And when I got there, he needed to do an x-ray. And we had to carry him outside to go and have an x-ray done. I went there in the evening to visit him, and I look at those images, and I said in my heart that these are poor images. While we were looking around that, the management of the hospital too thought they needed to move to acquire other things, like an MRI and a CT scan. We met with the board, we submitted our proposal, we won the bid to put a CT and MRI within the facility. At the time that we won the bid, we did not have the resources. We went around so many banks with our proposal, but we knew clearly that going through the bank may not be the best option. So we started approaching other financial institutions. That's how we came across MCF.
Our first encounter with Cresway came from our banking partners, and there was very engaging because I could see a provider who had a vision. Prior to that, we had never done something like that, where a private healthcare provider would have a partnership with a government entity and then seek financing and we'll be able to get that. So it was really an interesting opportunity to explore. And that meeting showcased that there are people out there who also have like minds in terms of what we want to achieve as an organization.
Through our experience and our work in Nigeria and in other countries, by the way, we recognize the fact that yes, we want to stimulate demand, yes, we want the clinics to deliver quality care, but in order for them to do that, they actually need access to funds to improve the quality, to expand their facility and provide better care. So the thought of MCF was born. It was started in 2009 by PharmAccess Group. Because we're not a financial institution, we have to partner with local banks. It's very well known that the banks don't understand what the healthcare sector does. They don't understand how they operate. So MCF is there as a bridge between the healthcare institution and the banks to make them understand each other, to facilitate the requirements needed by the banks for them to be able to access the loans. And these SMEs predominantly are the ones that are focused on delivering care to the lower income communities.
For us, the health segment is a very important part of the economy. So that's why we're involved with the Medical Credit Fund. For them to do the initial, should I call it diagnostics of the business, and then get back to us while we take care of the funding.
So MCF was able to provide us with the funding to build that center. And now MCF has come up again to be able to provide the funding for the equipment for that center, which is brilliant.
MCF creates impact. Basically, you want the poor man who is in need of health to be able to have quality health. We've had different levels of providers who have come at their various category to ask for, have access to finance, and they've had loan. A case in point will be one of our hospitals in a really very small hospital, you say. Now they serve, if you know the Relay community very well, you see a lot of poor or pro-poor indigents that live there. But these people also have need for quality health care. And that hospital, His Glory Hospital, resides in their midst. Now, when we financed him and he was able to improve on his quality, people, first of all, the initial shock was the fact that people thought that it was no more hospital for them because they were poor, but for the rich. But he kept on maintaining standard, he kept on maintaining pricing, and then the community started going there. So you see, that's the kind of things we want to do. There's been a lot of people that go in there to have quality health care.
Through the support of MCF, at least we're able to at least acquire some facilities, which has helped to improve our services in this place. My personal satisfaction comes from the fact that at least you see people in danger and they recover. Take for instance the child you saw there at the neonatal unit came in here from another hospital having been rejected in different places. 850 grams, not up to 1 kg. But the child today is 1.5 kg, and you feel happy that their life that would have been lost, is alive.
I think the most important you need to understand here is like for MCF, it's not about the loans alone. It is about the hospital improving from where they are to where they need to be. So the loan is always tied to a process of quality upgrade. So for the hospital, you get more than just funding.
So really, it is a very innovative fund. It provides loan as well as technical assistance to these facilities in terms of business planning, in terms of how they structure their operations, so that they're able to be more productive and utilize the funds as best as they can to ensure that they repay the loan. And we do this using a quality improvement tool called Safe Care methodology. We are at the point where we are having sessions with medical associations, encouraging them to take loans, encouraging them that it's better to take a loan, expand your facility, improve your services, have more business, and generate enough funds, not only to repay the loan, but still to have enough to continue to provide the services that you provide. It can only be good for Nigeria in the sense that there are more facilities that provide quality care. A lot more people can access care. And a healthier population is a more productive population. So we're hoping that ripple effect of stimulating this sector would end up in more hospitals, better quality care, and healthier population.